Smallpox vaccine dispensing site. This clinic is operating in response to a public health emergency. Smallpox variola virus. If you or another person in line near you needs an interpreter, please use the language ID card to show staff what language you speak or read. The following information will help you prepare to receive the vaccine from the professionals here who are involved in this response to incidents of smallpox. Smallpox is a serious health threat that is very contagious. People get smallpox by being in direct, close contact with an infectious person. The virus spreads when an infectious person coughs, sneezes, or talks. How smallpox spreads. Smallpox is spread to people in direct, close contact with an infectious person. Smallpox spreads when an infectious person coughs, sneezes, or talks. People also can be infected by touching bedding or clothing contaminated with the virus. Smallpox is not spread by insects or animals. Once the smallpox scabs fall off, the person can no longer spread the virus. If you have symptoms or are sick, please leave this site and go to a hospital or treatment center now. Look or listen for instructions on how to get to the nearest hospital or treatment center. Smallpox symptoms include high fever, extreme fatigue, head and back aches, vomiting, rash that turns into pus-filled lesions. If you already have symptoms of smallpox, you should leave here and immediately go to a hospital or treatment center for evaluation and the appropriate treatment. Look or listen for instructions on how to get to the nearest hospital or treatment center. The vaccine given today for possible smallpox exposure can lessen the severity of the illness or possibly prevent the illness entirely. If you feel you have been exposed to smallpox, but you are not sick with smallpox symptoms, please stay here. This dispensing site is administering vaccinations for smallpox. Vaccination within 4 days after exposure can prevent or significantly lessen the severity of smallpox in most people. In addition, vaccinations can provide immunity for 3 to 5 years. Pay close attention to the forms you complete. Those vaccinated today should follow post-vaccinations instructions carefully. Review the vaccine site appearance video before leaving the clinic. If you have been vaccinated previously, stay here. The following items are helpful in processing you and your family to receive the medications available here today. Although not required, please have available driver's license or ID, list of all medications or supplements you are currently taking, both prescription and over-the-counter. List of medical conditions and allergies. The items on the list are not required to receive medicine. If you do not have these items, stay here anyway. We want you to receive medicine today. The medicines and services you receive at this dispensing site do not require any payment from you. The medications are provided from the government. The service is provided free from your state or local health department. If you are pregnant, planning to become pregnant, or nursing, advise clinical staff before you are dispensed medications. The people working in this clinic may be staff of the health department or volunteers from the community. Please be patient with everyone as we serve your community during this event. Other information to review before being vaccinated. Smallpox vaccine and heart problems. Smallpox vaccine and skin conditions. Smallpox vaccine and pregnancy fact sheet. We appreciate your cooperation and patience as we provide the medicines and manpower to respond to this emergency situation. Everything that can be done by the medical and support staff of this response center is being done in the interest of public health and safety. Maintaining a high quality of public health is our job, and it is a job in which we take great pride. If you would like to review this material at a later date, ask a staff member where you may find it on the web, or look on the information you are given. A web address may be included on those. Most public libraries have computers and internet access free to the public. Where to get more information? Stay tuned to local media for ongoing updates. Centers for Disease Control and Prevention Public Response Hotlines. For English, 888-246-2675. For Spanish, 888-246-2857. And for TTY, 888-874-2646. Texas Department of State Health Services website is www.dshs.state.tx.us. Centers for Disease Control and Prevention website www.cdc.gov. Please stay here while this video is repeated for anyone who has not had a chance to see it. And once again, thank you for your patience and understanding.